With the country deep in the deadliest wave of the pandemic, millions wait for their chance to get the coronavirus vaccine. Good evening to you. I'm Anita Blanton.
And I'm Tom Shad. There has been a lot of confusion about the vaccine rollout plan in our area. Some cities are progressing faster than others, while residents reaching out to us and asking when they're next. And there's good reason for concern as the state surpasses 6,000 deaths. Things are moving a little more quickly in states other than Virginia and North Carolina. More than 15 million people in the U.S. have gotten at least one dose of the COVID-19 vaccine. That's according to the data tracker from the Centers for Disease Control and Prevention. Nearly 38 million doses have been distributed, but only about 46% administered.
There's been a gap between vaccines given and distributed in Virginia, so state health officials are chalking this up to a few reasons, like a reporting lag.
But also, some providers are holding back doses, worried that people won't get a second one. The health department tried again to clarify how they want things to work, and 10 on your side's Brett Hall shares their message.
Simply put, there has been a lot of new information about the COVID-19 vaccination program in Virginia just in the last couple of days. So we want to hit the highlights for you. First of all, the question everybody's been asking, why aren't things moving faster? It comes down to one word: supply, supply, and supply.
Vaccine supply is a really significant issue.
Dr. Danny Avula, who's been tapped to head the state's vaccination rollout, says in the past week, the Virginia Department of Health received requests for roughly 300,000 doses from local health departments, hospitals, and pharmacies. The problem is, what the federal government is currently giving the state each week,
only 105,000 doses to dole out.
So moving forward, the amount of vaccinations a city or town gets per week will coincide with the percent of Virginia's population that lives there. For instance, around 5% of Virginians call Virginia Beach home, meaning the city will receive around 5,300 doses.
And then the district has to determine what are the channels that vaccine is going to come through. How much is going to happen through mass events like this? How much are we going to rely on pharmacies or private providers? And how much are we going to rely on the health systems for?
And who in the priority phases will be prioritized when many people within a particular community will be eligible to get the shot. For instance, Virginia's Eastern Shore has nearly 3,000 frontline workers alone at Accomack County's 2 poultry processing plants. Avula says with scarce resources, extra vaccines can't be sent there right now to compensate. But Governor Ralph Northam is hopeful there soon will be.
The Defense Production Act, which President Biden has declared he's put into effect to help increase the number of doses that are being manufactured in the country.
Both say if everyone commits to having no vaccines go unused, they're confident the vaccine will be widely available in Virginia by this summer. Brett Hall, 10 on your side.